Now, here's a story to remember. One of my colleagues told it to me a long time ago. He had a patient once who was on vacation with his wife. One day, he got an erection and they had sex. But then, the erection would not cease, so they had sex a second time. After that, the erection would still not go away. The wife got very excited about that, and basically, for the next 2 days, they didn't get out of bed. So on the third day, they finally arrived at the hospital. End of the story. That was the last erection of his life. A case of priapism had put an end to his erectile ability. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. If you are looking for reliable urological information, UroChannel might just be the place to go. Subscribe and you will never miss out again on new content. So, what is priapism? It is a disease named after the ancient Greek god of fertility, Priapus, son of Aphrodite and Dionysus. He was depicted with a very large erect penis. Priapism is a pathological erection which occurs without sexual stimulation and lasts for many hours. If left untreated, it destroys the erectile mechanism of the penis, resulting in permanent erectile dysfunction. In urology, we differentiate between different forms of priapism. The by far most common one, which accounts for more than 95% of all episodes, is the so-called low-flow priapism, also known as ischemic priapism. The list of causes for priapism seems endless, at least far too detailed for this video. Just to name a few triggers: drugs for hypertension, anticoagulants as warfarin, alpha blockers, but also alcohol and marijuana, infections, leukemia, and overdosing of injection therapy for erectile dysfunction. Many times, the cause remains elusive, but there is one disease with a very high risk for developing priapism, and that is sickle cell disease. In the US, over 70,000 people have been diagnosed with sickle cell disease. It is an inherited red blood cell disorder where they take the form of a sickle, that tool you use for gardening. Ischemic priapism is what we call a compartment syndrome in medicine. Persisting pressure in a compartment like the penis that is not relieved will cause serious damage to the muscle involved. In this case, the smooth muscle of the corpora cavernosa. So every erection that is not sexually motivated and that doesn't subside and lasts for several hours should be considered a medical emergency. After 24 hours, the reported rate of resulting erectile dysfunction is over 90%. So what they will do in hospital is decompression, which consists of the aspiration of blood and applying so-called alpha agonists directly into the penis. This will be sufficient in most cases. All of this is done in local anesthesia, and since ischemic priapism hurts, the treatment will feel as a relief. Besides low-flow priapism, there is also high-flow priapism. It can happen after perineal trauma with formation of a fistula, leading to uncontrolled inflow of arterial blood into the penis. Because of that, the penis erects, but there is no entrapment of blood, and due to ongoing circulation, the cavernous bodies are not in danger. Usually, there is no pain with high-flow priapism either. The condition needs surgical intervention, but not as urgently as low-flow priapism. Finally, there is another kind of priapism which is called stuttering priapism. Episodes typically last under 4 hours. However, stuttering priapism and ischemic priapism fall into the same category, as stuttering priapism on the long run will do the same damage as ischemic priapism. Thanks for watching. Bye-bye.